All right, we are live on Facebook with another edition of this week's podcast. Welcome to Wealthy and Wise Wednesdays, where I share a few words of financial wisdom to help put you back in the driver's seat of your financial future. Today is Wednesday, May 19th. Thanks for joining me. Today, we are going to we're going to be talking about healthcare costs in retirement and how to plan for some of these unexpected things that most people don't think about, and they kind of leave themselves vulnerable for to where it can end up really hurting their retirement nest egg in their standard of living later on in retirement. But first, before we get to that topic, my standard disclaimer is that everything that we discuss here on these podcasts are for educational purposes only. They're not to be construed as specific financial advice for your personalized scenario. Again, so this is for information and education to empower you, my dear viewer, on some of the things that you might want to learn more about and implement into your financial life. And that's the wonderful thing about working with me. If you decide to enlist my services, is that I am able to do individualized personal planning for your specific scenario. Okay, so now that that is out of the way, let's do a brief market update, and then we're going to we'll get into the meat of today's topic. So over the past week, we've had a lot of turbulence in the stock market, a lot of red just about everywhere. Last week, we lost quite a bit of ground, and the market started to go back up toward the end of the week. But unfortunately, at the beginning of this week, it went right back down. Also, I looked this morning, and the cryptocurrency markets are being hammered as well. So as of right now, everything's down. Bitcoin is down 35 or 40% off its record high just about a month ago. Dogecoin is down. I know that there's a lot of big fans of Dogecoin right now with Elon Musk and all that he's doing to promote that coin. But the main reason why this is happening is because of the inflation concerns and economic fears that people have. I posted a chart on Facebook yesterday that showed that in the month of April, it was the largest 1 month drop for consumer confidence ever recorded, ever on record, because they're feeling the squeeze and they're seeing it in prices that they have to pay, everything from food to lumber to their housing. It's showing up in people's everyday lives. So consumer sentiment, consumer confidence way down, and that has affected the markets as inflation has went up. So that's just something to kind of keep your eye on moving forward. But again, flashy news headlines can make it tempting to make knee-jerk reactions. But the thing is, if you have a well-defined plan, your goals, you have a well-balanced portfolio, you have some non-correlated asset classes in there to serve as volatility buffers. And that's what I do with my clients, personalized planning. We make sure that we build their plan on a foundation of stability and security before kind of like moving up that pyramid into more aggressive or speculative investments like cryptocurrencies. Okay. So that is this week's market update. Everything is red. Again, people are still worried about inflation, and we'll just have to see where that's going to go here over the coming weeks and the coming months. Now let's get into today's topic, because today's topic is a really important one, especially for pre-retirees and retirees. Now, I know that when we're thinking about retirement, we are thinking about line dancing, cruises, golf, happy hour, things of that nature. And that's what the dream retirement is all about. It's about those fun recreational activities, spending time with your loved ones. But it's also important to make sure that you have enough money to cover all of those necessities. And let's face it, medical care is one of the most essential of them all. The fact of the matter is, after 5 years or so of retirement, retirees' spending, it falls off a cliff in every area except one: medical care. Unfortunately, far too many people dangerously underestimate just how much their medical care will cost. And if you're one of those people, you could find yourself in a position where you've drained your nest egg much faster than expected because you incur out-of-pocket medical expenses that you didn't plan for. Bottom line, healthcare is probably going to cost way more than you think. Many future retirees have a very optimistic, I guess, perhaps naive picture of what their healthcare spending is likely to be. Now, that's not necessarily their fault, so I don't mean that to sound condescending, and we'll get to that in a minute. But according to a recent study conducted by Fidelity, and I'll link the study below on my social channels, Fidelity study showed that 37% of non-retired adult financial decision makers estimated healthcare spending for a senior couple throughout the course of their lives in retirement would be somewhere between $50,000 to $100,000. Okay, so the average respondent said somewhere between $50,000 to $100,000 is what they would spend on their healthcare in retirement. And although that might seem like a lot of money, it is actually far less than what the average senior couple should actually expect to pay. In reality, what is Fidelity's estimate for out-of-pocket medical expenses during your retirement? $295,000. Let's repeat that. For the average 65-year-old couple who retired last year, going forward, their average healthcare cost over their retirement time horizon will be nearly $300,000. And that doesn't even include long-term care, such as if you go into a nursing home or assisted living facility, or if you need home health care. That piece is separate. And here's the other thing. We talked about inflation. Healthcare costs, they only go up year over year. So future retirees are likely to spend even more. But the thing is, with healthcare, that's one of those areas where the costs actually tend to rise even faster than the average pace of inflation. Now, it's understandable as to why many people underestimate the cost of healthcare. Number one, they're not experts. They don't do this every day. Number two is that many retirees simply assume that Medicare will take care of most of their costs and that Medicare covers a lot more than it actually does. Or they don't anticipate getting sick as early in retirement as many people actually do. Now, with all of this said, I probably don't need to tell you how incredibly damaging this can be to your portfolio and to your retirement plan. If you have to spend $250,000 more than what you planned just for your medical expenses, it's inevitable that you're going to deplete your nest egg much faster than you anticipated. So what's that going to mean for your standard of living? Or if just one spouse ends up getting really sick, what's that going to mean for the standard of living for the healthy surviving spouse and their relationship and their time with your friends and with your children and grandchildren? So failing to be realistic about healthcare expenses during retirement could leave you guys without the funds you need later in life if your account runs dry. And it can also mean that the extra money that you had hoped to leave as a legacy to your family, instead, that money could end up going to one of these local hospitals or nursing homes or the federal government. So my advice, start preparing for healthcare spending as soon as possible, no matter what age you are. You might be 35 years old and tuning into this. It's not too early. In fact, one of the best things that you can do is increase your retirement savings goals and your retirement contributions to compensate for out-of-pocket expenditures that you'll likely incur during your later years. So what does this mean? Well, this means taking full advantage of all the tax advantage tools that we have at our disposal. If you have a 401k match, make sure that you're taking advantage of that match. If you're eligible, maximize your contributions to a Roth IRA. And if you have access to a Roth 401k, which I think is the greatest thing since sliced bread, you may want to increase your contribution amount right there. Or maybe you're overfunding your traditional 401k. Like, for example, if you get a 3% match, but you're actually putting in 6%, you may want to take that extra 3% and just reposition it and put that 3% contribution into your Roth 401k. And why do I say that? Because taxes are likely to be much higher in the future. So For most people, the recommendation would be to pay the income tax now and then build your wealth tax-free, including if you need to use it for medical care. Now, speaking of tax advantages and medical care, if you're eligible for a health savings account, utilizing one of these can be one of the best ways to accumulate money that you need for retiree health care. Now, the HSA is the only account that actually offers 3 tax advantages instead of 2. Now, most tax advantage retirement accounts, like the ones we just mentioned, the 401k, the IRA, and Roth accounts, they offer 2 tax advantages. All 3 of them offer tax-free growth as the money's growing. And the second one is the ability to either, number one, contribute with pre-tax dollars and take your tax deduction right now. You can do that with a traditional 401k, IRA, 457, 403b, or the advantage would be you can make tax-free withdrawals later. Like you pay the tax now, and then you're able to make tax-free withdrawals down the line. And that would be things like your Roth IRA, your Roth 401k, and cash value life insurance. But the HSA allows you to have all 3 tax advantages. You get the tax deduction right now and invest with pre-tax funds. You avoid taxes on the gains of your money as your money grows. And as long as you withdraw it for qualified medical expenses, you can take taxes out without owing any income tax. And HSAs are also a good option because if you end up healthier than average, and if you don't need that money for medical expenditures, you can take the money out and use it for whatever you want, penalty-free, as long as you're 65 years of age or older. Now, the little slight caveat to that is, since in this scenario, if you're not using the funds for qualified medical expenses, you simply lose that 3rd tax advantage. But all that means is that at that point, you'll be taxed at your ordinary income tax rate. Same as if you were taking distributions from a 401k or from an IRA. All right, so point number 1 is increase your contributions to your retirement plans and your savings programs. Number 2 is to consider an HSA. Number 3, consider a Medicare supplement. So this is for people who are turning 65 years of age or they're already over that. So with a Medicare supplement, many people overestimate the amount that Medicare actually covers, and they are shocked to learn about the gaps and just how costly those gaps can be. If you're going to purchase a Medicare supplement or a Medigap program, the best thing that you can do is, number 1, shop around. But number 2, you want to do it as soon as you're eligible in those few months leading up to your 65th birthday, because you have a window that's called the guaranteed issue period, where there's no medical underwriting done when you're first eligible. So that means you can't be declined due to future health issues, and they cannot rate you a higher risk and jack up your premiums. So during this window, when you're about to turn 65 and the few months after your 65th birthday, it's the guaranteed issue period. So I highly suggest taking advantage of the Medicare supplement right away. And then finally, number 4. So we have number 1 is increase contributions to your retirement account or just simply save more, right? Number 2 is to consider the tax advantages of an HSA, and you can begin funding those very early in life. I have a client who I talked to last week. She's 37, 38. They're already funding their HSA. Number 3 is when you get to retirement to consider that Medicare supplement. And number 4, consider long-term care insurance. Earlier, we mentioned that Fidelity's average for healthcare costs in retirement, $295,000, does not include long-term healthcare costs at all. And according to the U.S. Department of Health and Human Services, 72% of seniors age 65 years of age and older will need some form of long-term care. Over 70%. While not all seniors are going to wind up in a nursing home or assisted living facility, of course, but if one does, the average cost of a nursing home in the United States is over $90,000 per year, according to a recent article by thebalance.com, which again, I'll link below on my social sites. And the median cost for full-time healthcare aid to come into your home, it's about $4,600 a month, according to Genworth. So there are three major types of long-term care protection strategies available to consumers. Number one is traditional long-term care insurance plans. And those plans, there's a variety of different things. There's options for in-care, in-home care, or facility-only care. Talk with a trusted financial professional or insurance professional about these plans. I actually own one of these already, and I'm only 40 years old. I wanted to buy mine at an early age, lock in my good health, and get my premiums going when I was young and healthy and the premiums are low. Okay, so that's one of the three major ways that you can protect against long-term care. The second major way is annuities, because many annuities have long-term care riders. So in some instances, these annuities that are paying you an income stream, it will increase the income to help pay for long-term care situations. For example, with one annuity that I'm familiar with, the income stream will actually double during a long-term care incident and stay at that increased level for up to 5 years. Again, this is in the event of a qualified long-term care incident. So again, the income that you're receiving doubles, and you can use that extra income to take care of your long-term care expenses. And then the third option finally is life insurance policies. Although these are a little bit different than traditional long-term care, there's a chronic illness rider on a lot of life insurance policies that you can get, and many of them are actually no cost. But what it does is it allows you to spend your death benefit while you're still alive and spend that death benefit on qualified chronic illness and long-term care expenses. And the great thing about using this strategy is if the person doesn't actually need long-term care, then they can access the cash value of the policy for tax-free income to supplement retirement. Or if they don't need that, they can simply then leave that death benefit to their family tax-free, and that will help create their legacy plan. The reason that I really like this strategy is because if you don't end up needing long-term care, God forbid you die of a heart attack in your sleep, instead of 30 years or 20 years of paying those premiums that you never used, you're paying premiums into a life insurance policy where the worst thing that could happen is you end up leaving your family or a charity a bunch of tax-free money, right? So you don't waste those premiums, so to speak. Now, as far as these three topics go, or these three strategies, the long-term care insurance, annuities, and life insurance, these are all insurance-based products. So again, make sure that you're checking with your financial professional, somebody who is an expert in insurance, and fully understand the policy provisions so that you know what is and what isn't covered and what qualifies as a long-term care incident under the terms of that contract. Now, I'll tell you this, when it comes to long-term care, the best time to start looking at your long-term care planning, your early 50s. There's a lot of outdated financial advice floating around by financial gurus like Dave Ramsey. Dave Ramsey, for example, recommends looking at long-term care policies once you're 60. But here's the problem with that advice. It's often too late by then because many people already have health issues that prevent them from obtaining coverage. Remember, long-term care is different than what I mentioned earlier with that guaranteed issue period. That's for Medicare supplements. For long-term care, there is no such provision. So you cannot just go out and buy a long-term care insurance plan. You must also qualify with good health. So in conclusion, wrapping up here, unfortunately, not everybody can invest in an HSA. Not everybody's eligible for a Roth IRA. Not everybody's eligible for a Roth 401k. And not everybody will qualify for long-term care insurance or life insurance. But here's the thing. You have a lot of different tools at your disposal. And even if you aren't eligible, you still need to figure out a way to accumulate enough money to cover the realistic cost of healthcare as you age. As mentioned above, there are a lot of different ways increasing contributions to your retirement plans that could work. Some people even open a special IRA that's specifically earmarked just for medical expenditures. That way, you'll have the peace of mind of knowing that there's a dedicated account with funds for your care. Whichever approach it is that you do take, the important thing is to recalibrate your expectations of what healthcare costs will look like so we can bring them back in line with reality so you don't end up being hurt in the long run. The sooner that we do that, the more sure that we can be that healthcare expenditures don't derail your financial security in retirement. So if you are interested in these topics and interested in planning for healthcare, and if you don't have a trusted advisor to help you out with that, I'd love to be that person for you. All you need to do is just send me a message on any of my social platforms, or you can email me at ronald.sneller@snellerfinancial.com. As always, I love your questions, and sometimes we do these podcasts based on what your questions and your concerns are. So if you have any questions that you want answered, whether it's about this topic or about something else that's on your mind financially, feel free to shoot me a message or send me an email. And finally, all of these podcasts are uploaded to my YouTube channel, and I actually create a lot of educational content on a variety of subjects that you can find over on my YouTube channel. So go to Sneller Financial Services on YouTube, follow my page, and click the notification bell so you're notified anytime that I upload new content. Well, thanks for joining me here today for Wealthy and Wise Wednesdays. I hope that you found it valuable and informational. And that's all we've got time for here today. So that's my rant. And as always, thanks for listening.